was saying, Associate Professor of Pediatrics at the University of Michigan. I focus on pediatric endocrinology. I work with kids and families with mostly type 1 diabetes at Mott Children's Hospital. And you know, I kind of participate, I guess, as a member of a community online in Twitter. I am at Joyce Lee, so at Joyclee. It's Joyce without the E. And I identify as doctor as designer because I'm very passionate about design thinking, and as it's a really important tool for thinking about how we can really think about patients as partners in the creation of healthcare systems that are more effective and produce better outcomes for all players in the health system. So I spend a lot of time on Twitter. I guess I'm up to 18,900 tweets. And so, so one of the things that I wanted to say before sort of jumping into our analyses was just that there is a robust diabetes community online, and I think they call themselves the DOC, and actually some of them are actually here in the room right now, so thanks for coming. Yeah. So, you know, it's people participating in Facebook, it's people participating in Twitter, it's communities of people that have formed organizations for advocacy, whether that's online or offline, you know, repositories for information, for sharing, there's blogs, right? So, and I really, really encourage my fellow healthcare professionals to be online. I think there's a lot of fear about social media, but I really feel that it's an important tool for us to understand the patient experience, because a lot of really wonderful information is being shared that we should be listening to and that we should be learning from. So I love this example. So I follow Carrie Sparling on Twitter. She's 6 Until Me, and you know, this is a mobile health technology conference, right? So you think that the next impressive mobile application for diabetes would be some newfangled app that does all sorts of things, like maybe measures your food or the carbs in your food, right? But I think this is a really great, simple example of mobile technology. So some patients wear this thing called the continuous glucose sensing monitor. And so what it does is it measures glucose every 5 minutes using interstitial glucose. And it alarms when you go low or when you trend high. And a lot of people actually can't hear the alarms because they're not loud enough, so they don't actually wake them up in the middle of the night, which would be really important if you're gonna experience a low in the middle of the night. So I thought this was the coolest thing that I never would have learned if I had not been listening, I guess, to a community that's sharing information and sharing useful information. So what some people do, what Carrie shared, was that what you can do is you can take the transmitter, right, which vibrates, you can stick it inside a glass, right, and you can stick it on your night table. And then you grab the iSeismometer app, which is an earthquake detection app, off of the App Store, right? And then when this thing vibrates, right, then the iSeismometer app alarms. So like, to me, that's like incredible, creative, mobile technology at work, patient-created, right, that the dumb provider, the dumb clinician never would have known about had one not been sort of lurking online, okay? But in any case, I just wanted to highlight some of the people that are participating today. You know, I follow those guys over there. But as well, you know, Doug Cantor, you know, who does really interesting data visualizations of his diabetes data. Dana, who's been working on her own do-it-yourself artificial pancreas, which you could probably hear about later this afternoon. The whole We Are Not Waiting movement, which is a community of people in the diabetes community who really want access to their data and are working for that very ferociously and in a really impactful way through this thing called Night Scout and CGM in the cloud. And I just also want to acknowledge Howard Look and his community for, you know, trying to build an open source data platform to integrate all of the different devices that our patients use to have access to their data and integrated views of their data. And then one other thing, so there's something called Diabetes Social Med, or DSMA. So DSMA is one of the hashtags that sort of forms the community, right? It's a hashtag that a lot of people use in the community. And for example, there's a tweet chat that happens every week at a certain time with using that hashtag. And Charisse, who runs it, had this question: what do you wish your healthcare provider, your device manufacturer knew about the DOC? And I think this is a very telling statement, like, I get more info from the DOC than I get from the DOC, right? So, kind of keep that in mind, healthcare professionals, medical providers, people who are not patients, like, we need to listen, learn, and lurk from our patient communities. So I think, I've made the case, I guess, for personal reasons, for professional reasons, why I like to use Twitter. And so we wanted to, I'm a health services researcher by trade, so we do a lot of analyses looking at health outcomes, and we look at hospitalizations and we look at hemoglobin A1C, right? But I think, the big missing piece to the clinical data is this other patient-reported data, and social media is a form of patient-reported data that I think researchers need to leverage more in their understanding of disease and its determinants, right? So, I would say the diabetes community, I don't know if you guys agree, but they're probably like one of the most advanced communities online. Like, it's just, there's a huge force happening online, and there's a lot of people participating. But when I went back to the literature to actually find studies, like formal studies in the literature of the network, I actually couldn't find much of anything. So that's why we wanted to do this study. So what we wanted to do was identify a community of individuals on Twitter. And Twitter is, it's one big mass of individuals, right? Maybe there's a lot of kind of invisible accounts too, but how do you identify a community? And we thought what we'd do is we take the approach of identifying a community based on a hashtag, right? That's sort of one way of approaching it. It may not be the only way, but that's the way we thought about doing it, right? And so we wanted to use either key diabetes-related terms and hashtags to identify diabetes-related tweets, and then the frequency with which the tweets were used across the different terms and hashtags. So warning to my fellow tweeters, like, this is preliminary data. I was literally doing some analyses this morning. So, working more with a graduate student back at University of Michigan to basically polish this up and actually turn it into a polished form, into a paper, but also wanting a lot of input from other individuals, particularly the diabetes community, about what questions you might have and what questions we might be able to answer with the type of data that we have. So just take it with a grain of salt, but at least you get a sense of the type of data that we can capture. So University of Michigan is lucky in that it has actually a contract with Twitter, so they actually have 10% of all tweets ever tweeted in their repository. And so what we decided to do was focus on just the calendar year 2013, and I came up with some terms, right? So the terms were sort of just free text, right? Glucose, blood glucose, diabetes, insulin pump, insulin, right? And then obviously there are hashtags that are that we also chose. So diabetes, I guess, is an obvious one. DSMA, we just talked about. DOC, we talked about. BG Now is an interesting hashtag that people use to just report on their blood sugar sort of in the moment on Twitter. And so then we tried to capture some other hashtags related to diabetes. And so the information we could extract from these tweets were content, the Twitter username, date and time, geolocation if it's available for the tweet, and then whether there was a retweet. We do have IRB approval from the University of Michigan School of Information, but we can't present any identifying data. So this is all public data. Like, you could go back into Twitter, you could do a search, you could find it, but we're not allowed to sort of reveal that users' identities. We're really supposed to talk about the group in aggregate. And one of the things that we tried to do was just try and understand who are the players or who are the individuals within a defined community. So we did that particularly for hashtag DSMA, and we used Mechanical Turk to be able to do this literally in the last 48 hours. So love technology. So in terms of our results, there were 623,481 tweets that had one of those tag words, right? So it could have been diabetes, could have been insulin, could have been any of the hashtags, right? There were 209,000 retweets, and then the number of retweets that have geolocation information is obviously a lot smaller, around 2%. I hope you can see this. So this is just the number of tweets and sort of decreasing frequency using these different hashtags. So these are not exclusive, right? So there could be tweets that use diabetes and insulin, or glucose and blood glucose, or glucose and hashtag T1D, but this is just for a given hashtag, how many tweets were there that use that hashtag or that keyword. So diabetes obviously sits at the top, and then it goes down insulin, glucose. DOC and DSMA are quite high up there, and then there's sort of this goes in descending order. Questions, thoughts? Yeah. Okay.
Oh, I'm eating like a huge piece of cake. That all the time. So
Yeah.
let's give you your results.
So I think that's why we try to do a sub-analysis with DSMA. Yeah, there's a lot of junk in the social media, right? And just by the sheer number of tweets and the number of individuals that you try and capture it from, the word diabetes does bring up all the. I mean, there's a lot of promotional things, right? There's a lot of sort of like marketing happening. So it is a little bit like, I guess, imprecise, and that's why I tried to sort of target a community that I actually know, right? So I just want to highlight DSMA, there were 5,498 tweets. But the one thing I want to mention again, this is 10% of tweets, right? So this is not all of tweets. So I guess you could theoretically multiply that by 10, but that doesn't necessarily mean that there's more users, right? Because this just would just be sort of a cross section of the people who happen to tweet at a certain frequency. And then this is just an example of among DSMA users and among all users, the number of tweets versus the number of users that actually use geotagging, right? So of that big mass of individuals and tweets, this is actually the discrete numbers of people that geotag. And we did a comparison just to see, so we looked at whether, sorry, this is not all users. This should say the diabetes, right? The diabetes terms, right? So about 2.5% geotagged, and that was actually not different than a totally random sample of Twitter users, right? So overall, regardless of diabetes, around 3% of people geotag their tweets, okay? And so there was a significant difference between those, but there actually wasn't a significant difference between DSMA and all users. But you can see the numbers are really small, so. All right, and then this is a heat map of tweets, and this starts with January, and then we're just gonna walk through to December, and these are kind of cumulative, right? So no tweets are going away. This is not a minute to minute. This is sort of overall what's cumulative happening throughout the year. There's probably some mistagging because you're gonna see some tweets like happen in the middle of the ocean. Okay, but this is kind of what it looks like, and I don't know if anyone has observations. I mean, I think the North America component is obviously quite noticeable, but I think it's sort of an interesting thing to see. In terms of the actual, like, what does the red mean, like how much of a density that is, I have to go back to the graduate student to like give me that information, because this is sort of another app that one of his fellow students is using to create this kind of imagery, and he didn't have that information about what the density really means, okay? So then this is tweets for the entire year. This is all of the diabetes tweets, and you can see some spikes, right? So this was Christina Kirchner in March 2013, posting a tweet saying that diabetes is a disease of affluent people. Okay, this is City of Hope fundraising for cancer and diabetes, and news about type 2 diabetes, mortality rates going down. Here we have Nick Jonas winning at Teen Choice 2013 for recognizing his efforts to help find a cure for diabetes with the Change for the Children Foundation, and then the biggest spike you see here is World Diabetes Day, right? Okay. All right, so this is where the Turkers tried to help us understand who's in a community, and this I really focused just on hashtag DSMA, just for the reasons that you mentioned, Kim. So I think, so a couple things. So you could have been mutually in two different categories, right? Because you could be a provider, but you could also be a patient with type 1, or you could be a provider, you could be a patient with type 2. So we tried to, so some of these obviously repeat, right? These are like, this is someone who's type 1 and who's actually at a diabetes company, right? But I think what's, interesting. I don't know what you guys think. I'd be curious to see what you think. But, you know, type 1 is what, 23, 24% of the users. There was a total of around 826. We only got to do about half. So we're going to have to go back and do the rest. So we only have like 391. But assuming that's a representative sample, right? So mostly type 1, a little bit of type 2, 2%, unknown diabetes, 9%. And then I think what's really telling is healthcare researchers, 2% doctor, 1% nurse, 1%. So like total absence of healthcare providers in that conversation, which may be appropriate, but also, you know, I think says something to me as a physician who's trying to get my colleagues to be more empathetic and to learn more about what's happening on social media online.
Regarding the question.
Okay, yeah, that's fine. I'm done. Okay, so limitations with 10% of tweets, like you can't visualize the network. I had the students visualize the network and it's just like a big mush ball, right? Like, so I didn't even want to show it because it's not going to tell us anything. You know, it'd be interesting to look at year-to-year data over time. Like, so this is 2013, but maybe 2014 we can run it again. And like we were saying before, there's lots of undefined users in the community. Future questions I have are, one, we actually have to, you know, confirm these findings. I'm curious about what questions the community has. You know, I don't know that I picked the right hashtags. Maybe there's many other hashtags that I should be considering that we can redo the analyses with. We want to do some network analysis with sort of subgroups of individuals so that we are not waiting movement, like we're actually trying to just track all of those tweets to figure out who's in that network and who's tweeting about it. And then we also have the option to do some sentiment analysis, and we just didn't have time to get to that yet by this presentation. But, you know, so there's sort of scales that exist that allow you to look at positive and negative sentiment, anger, sadness. And so those are some things that we want to look at as well for the population. So I will end with my tweet that says the biggest risk of social media in healthcare is not using it all. And I also want to make a plug for Health Design by Us, which I'll be presenting in the next room in a couple of minutes. This is a collaborative innovation network of individuals who are really interested in patient-centered participatory design, creating a culture of making health, and kind of bringing together people to share resources, tools, and technologies so that we can all get to the healthcare we need faster and in a more accelerated fashion. So happy to take questions. Thanks very much for your time.
So you have 1 minute for
Yeah, that's fine.
I assume you talked with the guys at Sperber about.
Yeah, I should talk to them. I will go talk to them. Thanks. Oh, hey, he's here. Nice. Okay. Okay, great. Do you guys have access to everything?
Everything since we started tracking. We have about 100%.
Wow. Oh, yeah, so we should definitely talk. Thanks very much.
This is a research project that I've been doing with my colleagues at the University of Edinburgh, where we wanted to understand a bit more about how diabetes was discussed on Twitter. So I'm just going to do a very quick introduction. I'm sure most people sort of are aware of this anyway, but we've got two parallel trends that exist in society at the moment. One of them is around internet penetration, and that's obviously on the increase. And I think the latest figures I saw were 500 million tweets a day, although I'm sure that has increased over the course of the past few days with this conference. So the other thing that is also in the increase is the number of patients suffering diagnosed with diabetes and having to manage that on a worldwide basis. So the latest figures from the International Diabetes Federation is that actually by 2035, 592 million people will be diagnosed with diabetes. So when you consider those two sort of trends, it's quite an interesting topic in terms of the research potential associated with Twitter and other social media sites for the purposes of public health research. So over recent years, there's been a lot of research into this area. They tend to fall into 4 buckets. So there's obviously positioning and opinion papers that exist. These talk about the benefits, the challenges, the opportunity associated with social media, particularly in relation to diabetes and other conditions. There's the systematic and scoping reviews that exist. So last year and also early this year, there's been a few studies that have been published that relate to using social media for public health research and practice, healthcare communication, and also understanding how people use social media. So that's talking about patients, HCPs, caregivers, etc. So there's also the observational studies bucket. So these tend to come from the population health sciences space, the behavioral science space, psychology, trying to understand what people use social media and Twitter for. And I think also the epidemiological space where you've got the, for example, H1N1, swine flu, they're using a lot of Twitter data to track infectious disease through a population. But there's also, obviously, that's been extended to include things like cancer, so breast cancer is quite a hot topic. I'm interested to hear your talk after this. But also other health-related topics, things like, obviously, diabetes is one, but things like people's perception of antibiotics, vaccines, cardiac arrest, suicide risk using Twitter data. Then there's the final bucket, which is around experimental studies. So these tend to come from the computer science and informatics research space. So they've used public health topics to sort of test some of their algorithms and techniques around data mining, content analysis, and a number of other things. So this study that we conducted actually fits into the observational study piece. And I'm now going to go into sort of a bit more detail around that. So we wanted to understand not just about the number of tweets that people were using to talk about diabetes, but also what actual topics were they discussing, what were the intentions behind the messages that were being posted. So we had a number of hypotheses that we wanted to test. One of them was around the dissemination of information. So were people using Twitter to share information about diabetes, or were they using it to seek information about diabetes? We also had a interest in trying to understand actually what type of diabetes is the most prevalent within the Twitter space. And we guessed initially that it was going to be type 2, and we wanted to test whether that was going to be correct or not. So the third hypothesis that we tested was around the cause and prevention of diabetes as a topic that's discussed within Twitter. So whether is it related to the cause and prevention, or is it related to more the management and the treatment of the condition? And so we wanted to understand a little bit more about that. And actually, is the information on Twitter relevant to patients, or is it relevant to other stakeholder groups within the healthcare environment that are interested or associated with the condition of diabetes? So we applied a three-stage approach. We first obviously extracted the data, but then after we'd extracted the data, we used the four-phase Prisma approach to sort of select and screen the data for relevance, basically, so that when we had our final sample, that we could then go through it and use that as the basis for qualitative analysis. Now, we developed a classification structure that I'll share with you in a minute, but we used that to basically code each of the tweets that we had within our sample. We then went through a bit of a statistical analysis of the qualitative results. Now, that was broken down into two parts, the descriptive statistics, but also trying to get meaning out of the data itself. So we did a cluster analysis technique. So for the geeks amongst us, this is a bit of a summary of the data that we used. So we had a 1% sample, so the fact that you have access to a much wider sample is great news for us. And we looked at a very short time period. So we were looking at the September 2013. We extracted all tweets that had made reference to diabetes. So we had initially a sample of over 3,000. But once you remove non-English tweets and spam, because there's quite a bit of that as well, we ended up with about 2,800. Now, we then had to screen it to say, actually, is this relevant to the condition and health, or is it just, like you mentioned before, is it a joke? Is it, just a synonym for diabetes, synonym for sweet? And so we ended up with a final sample of 1,925 tweets, which we used as the qualitative analysis. So non-health related tweets. Now, what do these look like? So I'm pretty sure we can all agree, found a jelly bean in my Skittles like a surprise gift from the diabetes fairy is not really relevant to the clinical condition. Okay? So once we'd filtered those out, we then obviously had health-related tweets. Now, these are ones that are much more relevant to individuals, people who either are suffering from the condition themselves or have family members that do, or are involved in the treatment of the condition. There's advice in terms of how to manage your risk. Is it related to diet, exercise, for example? And also there was things around the fundraising associated with diabetes research. So we classified those as all health related. So when we then went into the qualitative analysis phase, we iteratively developed a classification structure that of codes that we applied to all to the sample. So this classification structure covered a number of things. We looked at the tweet content itself. So was it related to the cause and prevention? Was it related to diagnosis and treatment management? I have to say, although we got it down to 6 codes now, originally it was over 20. We had things like, was it related to diet? Was it related to exercise? Did it refer to insulin? Did it, was it blood glucose level, for example? And then we also included what type of diabetes it was. So type 1, type 2, gestational. We also included pre-diabetes, although I know there's a bit of controversy as to whether that's actually a term that's valid. But we wanted to see actually whether it was referred to in the data. We then looked at the stakeholder group for which the tweet was relevant. So was it relevant for a patient? Was it relevant for a provider? Was it relevant to a regulator or a payer or a charity or any news channel that was posting the information? And then we looked at the intention behind the tweet. So we used Bayes' interaction process analysis technique. We based it on that. And we defined 6 codes. So things like, was it information seeking, information giving, opinion given, opinion seeking, etc. And we also included the characteristic of the tweet itself. So was it a retweet, which is what we meant by duplicate, and also who posted it? Was it posted by an organization or community? So here's some of the results from this study. So if we go back to the 4 hypotheses that we were trying to test. So is Twitter used to seek and share information about diabetes with other users? We can say that yes, it is, based on the sample that we have. So information giving. But in terms of information seeking, 2.5% of the sample. So that's significantly lower than actually the information giving, which suggests more of a push for information rather than a pull. From a type 2 diabetes perspective, that was the most prominent that was discussed in the sample. The next one was type 1, which was about 6% of the sample, and gestational, which was just over 1%. The third hypothesis actually was proved to be invalid because actually the biggest percentage of the tweets was actually related to the diagnosis, treatment, management of it. And then the fourth hypothesis, which was around patients being the dominating group that the content was relevant for, was actually 16.5%. So that was the descriptive statistics that we conducted. We now went into the more sophisticated stuff, the hierarchical cluster analysis that we conducted now. Can I just ask, has anybody seen one of these graphs before? Okay, good. So it's a dendrogram. But just to sort of give people who haven't seen one of these before, it's a way of grouping data points, so the tweets, together in terms of similarity. So are they correlated? So you can get some more meaning from the data itself. So I won't go through all of this in detail, but I wanted to pull out a couple of things. So charity and support seeking. So these are support seeking tweets that are relevant for a charity, are highly correlated, which I guess if you think about it from a logical perspective, that makes sense because a lot of the support seeking that you see is related to fundraising, emotional support for people who are about to embark on a marathon, for example, that sort of thing. The other thing that I wanted to draw out was the diagnosis, treatment, and management and its correlation with the news, and also the company and brand and regulator. So if the tweet referred to a company or brand, it was highly correlated with regulators, being relevant for regulators, which kind of makes sense because actually most people don't refer to what product they're using or what treatment they're using. But what people do refer to is if a treatment has been approved or has been removed from the market by a regulator. Okay. Okay, so I mean, there's a couple of other things. I'm conscious of time, but so cause and prevention was highly correlated with type 2 diabetes, which is also an interesting one as well, because actually, I think because of the nature of the condition, type 2 diabetes condition, there's a lot of advice out there in terms of how do you reduce the risk of getting it. How do you, and it's all related to diet and exercise, etc. So in conclusion, Twitter is a valid source of data for public health research, as of 60% of the tweets that were included in the sample were actually relevant to the clinical condition. However, it really very much depends on what you're trying to study, what you're trying to find. So if you are trying to get patient-specific insight, you may not want to use Twitter to do that because a number of reasons that I've listed here. There's much more push rather than pull for information. There's a high correlation between diagnosis, treatment, management, and media and news stories. And also the fact that actually 1 in 5 tweets is posted by an organizational community, not by a patient. So these are things that are worth considering. So that leaves me to say thank you. And I've got time for questions. Good.
Absolutely.
So good morning, everybody. My name is Jem Lee, and I'm a research scientist at the Cancer Prevention Institute of California. We're based right across the Dumbarton Bridge, if you're familiar with the Bay Area in Fremont. And I'm also a consulting assistant professor here at Stanford University. So today, I will be talking to you about a pilot study that we've been conducting at CPIC in collaboration with Stanford. Actually, this is my first time at a Stanford Medicine X conference, so I wasn't quite sure what to expect in terms of a lot of numbers I'm presenting, but if there's any questions that maybe non-research scientists have, just feel free to stop me anytime. So, and also just a little bit about myself. I'm trained as a social epidemiologist, so I'm very interested in the social environment and health outcomes. And my particular area of interest has always been around social networking, both originally in-person networking, now moving towards online networking, and looking at the relationship between that and how it affects outcomes, health outcomes. So this pilot study, it's the right arrow, okay? So we are focused on breast cancer survivors, at least my area of specialty at CPIC. And this is a graph showing, a pie chart showing the distribution of the estimated number of cancer patients and survivors in the US as of 2012. So this is the latest data. As you can see, 22% of all cancer survivors are breast cancer patients or survivors. And I use both terms because I think people prefer, there's no consensus on what term to use, so I'm going to use both terms. It is the largest proportion of cancer survivors in the US. This chart also shows the projected number of cancer survivors we expect to see in the US. And as you can see, this is all cancer. I couldn't find one just for breast cancer, but it's the same growing trend that we're seeing with the population in the US. As the population continues to age, we are seeing more cancer, and we are seeing more cancer survivors also, especially for the ones with very high survival rates. And this is only going to continue to increase in the future. Now, just looking at breast cancer, just to give you a sense of what the breast cancer survivor patient population looks like in the US, this is the estimated number of survivors as of 2012. And this is a statistic showing the 5-year survival rate right now for all breast cancer patients and survivors at 88.9%. So it's one of those cancers that it has a very high survival rate. The median age of diagnosis is about 61. And then the prevalence by years since diagnosis. So we see a lot of newly diagnosed patients. That's the orange bar of less than 1 year. That's usually the period where most women go through a diagnosis and finish their treatment in the first year. The red segments of that are the 1 to 5 year survivors. And then, as you can see, the majority of breast cancer survivors constitute about 70% of all breast cancer survivor patients who are at least 5 years out from diagnosis. And for a majority of these women, they are pretty much done with treatment, even endocrine therapy. But they are still being monitored. And after this phase, there's a lot of gap in the research literature now in breast cancer survivorship studies of what's next for them, because they still continue to experience a lot of distress and problems resulting from their breast cancer diagnosis, even after 5 years. So this is all to set you up to make the point that cancer survivorship needs are a growing public health priority. Just in the last 30 years, as I've shown, the 5-year survival rate has increased from 74.9% to about 88%. Oh, I'm sorry, I didn't put in the reference. I should have checked that, but it was the same reference as before. And as the active treatment, again, is usually within the first 12 months, and that would constitute usually chemo, radiation, or surgery, depending on the stage, the extent of disease, and the preference of the patient as well. So, but post-active treatment, after that initial treatment is finished, usually consists of endocrine therapy, such as tamoxifen, which women are often on for 5 years at least. So, during this time, they can experience psychosocial distress, fears of cancer recurrence, and second cancers. Once you have breast cancer, you are at risk for getting diagnosed with a second type of cancer, ovarian cancer or some other cancer. There are also issues with side effects and symptom management, and also prevention of increased health risks, such as osteoporosis. So women who are diagnosed with breast cancer are also at higher risk for other chronic conditions as well, and clinical conditions. So the problem that we are facing now is that women who are out of treatment for breast cancer still experience distress and have needs for follow-up care and support. However, we are just scratching the surface of how to deal with that problem. And why do we care? So there is actually a name that has been, coined coming out of the NIH about this segment of cancer survivors, those who have finished treatment. This is the transition from active treatment to post-treatment care, and it's been identified as a critical area that warrants further research to identify unmet needs and interventions to support breast cancer survivors. And there was a report that was issued out by the NIH about, I'd say 5 years ago, and it was called Lost in Transition, for this segment of the cancer survivor population, playing on the movie title Lost in Translation. But it is a lost in transition phase because it's always the question of what's next, what kind of support will I get? I'm not seeing my doctors as often anymore. So this led me, being a huge social media enthusiast and avid user, the question of how social networking sites can play a role in the health of out-of-treatment breast cancer survivors. This is just a formal definition that social networking sites function primarily for individuals to maintain, form, and visualize their social networks. So I put up this formal definition to differentiate from what we've seen with Web 1.0 before with listservs and forums and things like that. This is really modeled after the Facebook social networking model, where you actually go into a website, a social networking website, where you can actually connect to people. And it's very different from what we've seen before in the 90s with the listservs. So through internet support. And social networking sites actually offer a convenient way to obtain information and emotional support from peers, particularly during times of uncertainty and stress. And as we all know, I don't have to say and preach this to the choir, it's a rapidly growing part of the online experience with enormous under-tapped potential for health promotion. I think with conferences like this, I think we're starting to build a momentum of how can social networking sites play a role in that. But it's still, at least for cancer survivors, it's still very much under-tapped in terms of how we can use it to support survivors. The advantages of that are if we can prove it's effective, it can cost efficiently maximize reach to the target population of internet users. Obviously, to have access to a social networking site, you need to be an internet user. And also, there are lots of different social networking sites on there. There are the mainstream ones that most of the public is familiar with, such as Facebook and Twitter. Those are not disease-specific, although they have some disease-specific pages within them. But there are now, in the last few years especially, cropping up these new disease-specific social networking sites. And some are very broad, targeting all patients who are suffering any type of chronic disease, patients like me, smartpatients.com. But then there are also very specific social networking sites just for that particular disease. So one example I want to give is my BC team. And this is a web page profile from, and God bless Helen, she let me share this with the group today. But Helen Chen was a project coordinator for this study, and she was diagnosed with breast cancer at age 28. And that prompted her to work at CPIC. And she was such a great, talk about patient engagement and being in research. She was such a huge asset to our pilot study. But this is her My BC Team webpage. And I'm not in any way endorsing My BC Team or selling it, but this is just an example of a social networking site that's disease specific. And what's interesting is that when I actually went out to meet the CEO of, it's actually part of the myhealthteams.com, and they actually put out disease-specific sites. They did my autism team, they did my MS team, and they did my BC team. But when I went out to meet the CEO of My Health Teams who did this site, they were very protective of this site. They don't want researchers on it. They don't want anyone who doesn't have breast cancer on it. It's very much protected for women with breast cancer. So this is a sample page of Helen's page. She's 30 years old now. Well, last year she was. So trends in social networking site use. I don't think I have to, again, preach to the choir about this, but trends are going up in all age categories, some more rapid than others. But this is a good sign that I think this is really a sign of the times that we need to respond to the trends that are out there and how can we leverage this and intersect this with health. And this is from the Pew Internet data, of course. So this is all background and setup for the current study I'll be talking about. It's a pilot study that's in progress, so I'll actually only be presenting one portion of the study today. It was a mixed method study using qualitative and quantitative data to assess use and influence of social networking sites in breast cancer survivors. So we had two specific aims, but the specific aim I'll be addressing today, because we're still working on aim 2 analysis, is the qualitative data part, which this was a patient contact study. 3 minutes. Okay, I'll try to zip through this quickly. I won't read this, but this was really our aim, was to identify motivators and barriers in information and value of social networking sites. This was our eligibility criteria. We did focus group interviews. We went through the whole qualitative analysis rigor of transcribing using grounded theory, using deduced qualitative analysis software and coding. So I'll skip through that. This is a slide showing our participant characteristics. We really set out to look at racial ethnic differences to see if there are differences in terms of use. And so we sampled by that. We didn't get, because it was only English speaking, we didn't get a lot of Asians and Hispanic women, unfortunately. So it's a pretty diverse population. We looked at users and non-users. And for the results, I just want to briefly outline the 3 main themes that we found from the qualitative portion of the study. One for social networking site users, one for non-users, and one cutting across all participants in the theme 1 work. So theme 1, we found that breast cancer survivors have a strong desire to build, be a part of, and give back to the community. This was a theme that really resonated over and over and over again. And the quotes that I saw that I wanted to highlight is really, I mean, I won't read all of it, and maybe a few snippets, but there is this feeling that people just don't understand what they're going through, even if they sympathize. So I think we hear it all the time here, again, with the e-patients. This was a way for them to connect with other people who were going through the same thing. And the other part of this is that these women also wanted to give back to the community because they were out of treatment. They really wanted to share their experience in providing support to those who are newly diagnosed. For theme 2, for non-users, this was interesting. There were 2 sub-themes I noticed. There was the lack of awareness of the existence and functionality of social networking sites for the patient community. And I think for this, among non-users, even though they were very active internet users, there was this taboo around using social networking sites and a lot of fears around that. There was a lot of strong anti-social networking site attitudes and negative perceptions based on their use with Facebook, mainly. It was seen basically as a source of gossip. So that's why they really did not want to use it. Another sub-theme is that they did not want to be reminded of their disease, nor do they want to construct their identity based solely on their breast cancer status. And there's more to that, but unfortunately with the limited time, I'll have to zip through the next one. So there was also another cross-cutting theme across both non-users and users, in that there appears to be very polarizing attitudes around the use of social networking sites for health. The attitudes and use or lack of use were largely driven by intrinsic personality traits rather than by cultural norms related to health-seeking behaviors and possibly introversion-extroversion traits. I can go on and talk about this in depth for a long time. I found this really fascinating because we set out to look at racial ethnic differences and cultural differences. And we found that even within African American women, there were women, African American women who loved it and women who didn't love it. And it was really just the personality traits that came out of whether or not they wanted to share or wanted to be more private. And so these are some quotes illustrating. I'm in question time now. Okay. So I won't read all of this, but I will read the purple, which I think highlights some of these personality traits that come across. One Latina breast cancer survivor who's a non-user says, I guess I'm just more quiet about it than some people who need to have this. Another non-Hispanic white social networking site user uses it because it's validating and vindicating an incredibly important thing in my life. And for her, she actually was so much of a people pleaser. This quote just showed that, you know, she couldn't respond to all the needs of everybody in her life. And when she went to her social networking support system, they told her it's okay, you can't respond to all of this. You don't need to. We're here to support you. You know, it was validating to her that she didn't need to be this people pleaser. to people in her real life. And so this illustrates a potential gap in overcoming the barriers for using social networking sites for the patient community. And one of the participants was, really, she had this great idea because a lot of women didn't want to use the sites because of just not being reminded by their disease, but they still looked at it as a source for support. And this was her suggestion. I wonder if there's a website that anyone has started. Okay, this is for cancer patients, but we are not going to discuss the cancer. We're going to discuss the positive things we've done today or last week. You know what? What did you do? I had a weekend at Great America. Doesn't that sound good? And I think when you go onto these social networking sites, you do see a lot of, we had people who demo the sites, and they literally, after 2 minutes, didn't want to hear the sad stories on the site, but they did want the support. And then just pilot study strengths. This is a pilot study, so it's still very exploratory. I think one of the key things is that we really try to look across ethnic groups, and that's really important to us in terms of understanding health disparities. Next steps is to analyze the quantitative online survey data. We do want to test the hypothesis of whether or not using social networking sites improves quality of life among breast cancer survivors. We were invited to develop this into a full manuscript for PLOS One. We want to leverage these pilot findings to develop more robust studies to add to the evidence base. And I will end on that note. 30,000-foot view for me in terms of questions from the pilot. Ultimately, and I just tweeted this yesterday, based on the talk, how do we safely integrate social networking sites into our care? This is another story that I can share later in the questions section. And this is our study team. Sure.
My research, I'm a doctoral student at Brandeis University, the Heller School, so I feel like I'm one of two people at MedX who's a policy person, but you need us. And my research for my dissertation is around a specific community, and I'll get more into that community as we talk. So, but I wanted to start with a story because I do qualitative research and we are full of stories. And that is one of the women I interviewed, a patient, I'll call her Alice. In our conversation, she told me that she found out that she was pregnant and had cancer in the same week. And actually, the way that happened was she found a lump in her breast. She went to the doctor. They ask all kinds of questions, do all kinds of tests. So in addition to the diagnosis, they also told her that she was pregnant with her daughter. So she did something very uncharacteristic for her. She was not someone that disclosed a lot of personal information online, even though professionally she did use social media. And she sent out a few tweets that talked about what she was going through and what she was experiencing. And to her surprise, she didn't tag it with anything. She just didn't know where else to turn. She had a great husband, great friends, but no one else in her situation. It's a pretty unique situation. And to her surprise, someone actually tweeted back at her fairly quickly that just said, I've been there. Like I've been in the same situation. So, I think that really struck me and it spoke to some of the power of why I'm doing this type of research. So, this is, I totally stole this from Susanna Fox's blog. This is a cartoon Jessica Hagee writes, Indexed, which is a cartoon. And essentially what it illustrates is what I think we've been hearing a lot over the course of this conference, that there's something clinical that happens, whether it's at birth or whether it's, an acute event that happens over the course of your life. You are trying to get the information you need. You're not necessarily getting all your needs filled. So you're frustrated for one reason or another. And so there's that middle ground of the Venn where you try to find some help, or you try to do something. You're frustrated, you try to seek help. Here they say Google, but you can insert whatever it is that you might use to find help, whether it's a social networking site or an online portal otherwise, or just Google, just Dr. Google as it's referred to. And some of this, I think in how we're talking about this at MedX and how we talk about patient-centered care and how we all say the same thing, but we don't necessarily mean the same thing. So this is just a little bit of what frames my own thinking and how I approach my research itself. So when we define patient-centered care, there's a report called this from the Institute of Medicine. I don't know if people are familiar with that, but they're kind of a big deal. And they put this report out about 13 years ago called Crossing the Quality Chasm. And in that, they defined patient-centered care. And this is sort of how they define patient-centered care happening. And what I'll say about this is this is significant to me because if you look at the Affordable Care Act today, it is rooted in a lot of what was said within this report, Crossing the Quality Chasm. You can actually look like line for line of things that they suggested should happen and things that have been adopted into Obamacare. So the way that these terms are defined leads to the way that these terms are codified and the way that systems are built around them. So from the IOM perspective, I'll start at the right, because I'm Jewish, we were at the left. So you have, ultimately you want outcomes, safe, effective, efficient. This is what you want for every patient. This is what every patient wants for themselves. In order to have that, you need high-performing patient-centered teams, right? In order to have these high-performing patient-centered teams, you need organizations that facilitate their work. It already makes sense. And within that, supporting all that is a supportive environment. It's policy, regulation, organizational. So we have actually that picture should be moved, over the high-performing teams. But what about these guys? What about the patients? It's not a part of the system that has been defined or the system under which that we're really working. So, and apologize for the cheesy stock images. It gets the point across. And I think that's certainly something we hear at MEDEX, something I've been hearing for the last couple of days. I actually thought about tossing all my slides and just having a conversation with everyone about this. But, how do we get the patient voice? So this is sort of a modified model that I'm sort of putting out there that really tries to incorporate and value the patient voice as well. So we still want the same outcomes, right? But how do we engage patients so that they feel empowered, that they are more activated, that pairs up with the high-performing patient-centered teams to get them in there? How do we incorporate these informal, semi-structured systems that encourage participation, and pair that up with the organizations that facilitate the work? And how do we create the supportive environment that can be the underpinning of all of this? So now you have a little bit of how my brain sort of functions going into this research. And these are some of the high-level questions. As with anyone's research here, we can only give you a small slice. As with anyone you talk to, you give them about 0.1% of all that you care about and think about. But these are some of the overarching questions. How is social media impacting the ways we communicate, engage about health? And for the purposes of my work here, can a public social media platform, and it's really important, can a public social media platform act as a viable means of creating a community? So the way that I've gone about this is a little different than my predecessors, which is awesome because this is a growing field and there's all different ways to approach this. So I've built in depth by design. What I'm doing is I'm looking at a single hashtag. I'm not going across the spectrum. I'm not looking at the specific word within bios or within tweets, but I'm looking at actually a specific community that is identified by a hashtag. So it's like I kind of sit back and watch the play unfold in front of me. What I'm trying to do is not put the topic at the center, but actually put the people at the center of the research itself, and see more than what do I talk about when I talk about breast cancer, but what are we talking about once we're in a community that we all know that this is some sort of unifying element. This is a prospective cohort study, meaning I have been scraping Twitter manually. I'd love to do it otherwise, but currently the systems aren't quite there. I've said that I'm going to be following this specific hashtag, this specific community, knowing that as a qualitative researcher, things change over time. Like I said, I'm kind of an audience member in a play and I watch it unfold. So I have to be willing to go with the twists and turns. And this community is very much evolving. And even over the course of the 3 months that I was really actively watching, they've made some changes in how they function, which I find fascinating. And as a researcher, what this, from a methods perspective, there are definitely new challenges to consider. I'm doing a combination of tweets and interviews, and it is very hard to maintain anonymity. I'm okay with the fact that they disclose themselves. I put that in my IRB, but as we're going online and doing research, we have to understand that people are going to self-disclose because maybe they think it's cool that their voice is, that they're being asked to participate in something, or maybe they just like to talk to each other, and this is the avenue through which they speak to one another. The volume of data also really large, as anyone who looks at Twitter for research or otherwise knows. And sort of making that manageable can be absolutely a challenge. And the third challenge that I really faced, because Twitter is such an ephemeral medium, and that is the primary means for my outreach and recruitment for interviews. I also had the World Cup happen when I was doing a lot of my tweet research, which, as you may know, shoves lots of tweets off the timeline. It has been very difficult to find people just by sending out tweets. And I've been much more successful if I specifically target people. But that goes back to some of the anonymity in terms of how I need to really be careful about how I'm reaching out to people. So if someone was to go into their specific tweet stream, wouldn't necessarily know why I'm trying to get with them. So I, often will do something fairly benign and then try to get out of Twitter as quick as possible, even though how I found them is through Twitter. This is the community. For those that are not familiar, it's Breast Cancer Social Media, BCSM. And this is the way they describe themselves. They're a dynamic online network and community dedicated exclusively to women and men affected by breast cancer. They have a chat every Monday night, 6 p.m. Pacific, 9 p.m. Eastern. They have an ongoing conversation where things get tagged in between, but you can tell Monday nights it's like a 700%. I know that you guys have done some analysis on BCSM, and you just see these very clear spikes on Monday night that show when the chat is happening, but it is active all week. So that is how they describe themselves. And this is how, if you ask people to describe them, this is something that I heard from multiple people, how the community would describe themselves. And it is also, BCSM is unique, and part of the reason I selected it is because there's a difference between an online community and a community online. And these guys are an online community, don't exist except for Twitter allowing them to exist. Twitter, which was not built for healthcare, but which they're using for healthcare because it is such a fast and easy medium to plug into. But it's not like they're a local running group, and they happen to have an online forum to talk. Like, if that forum went away, they could still meet on Tuesday nights and run. This group of people only exists because of this platform. Just some high-level data. Like many others, I'm in the midst of things right now. Just so you can see some of what I have been collecting over time on Twitter, just over 13,000 tweets. What's interesting, things that are interesting to me is the unique users tagging BCSM. So many people tag it, but if you look at how many people are actually tagging it multiple times, and this was over the course of 3 months for my tweet data collection, interviews are still happening, the number gets much smaller. So that's where you really get to the core group. And so what this says to me is that there are a number of people that are plugging into the community because they know it's an attentive audience. And so it becomes this collection. And so there's something to be said as well for creating these spaces where others know they could find an attentive audience as well. But maybe they're just in there for promotion or whatever, something like that. This is a map. Again, this is over the course of like 93 days, I think. Where people are tweeting from. It's only accurate to the extent that people put information in their bios. So if they say, I live in the middle of the Indian Ocean, that's where their tweet will pop up. But you can see that even over a short period of time is very much a global network. And here, this is just a zoom in on where they are in the US. So you have most states represented at least once. The Dakotas, there's not a lot of people in general, but I'm sure if I did for longer, we would find some people there as well. So this is what BCSM looks like from a tweet perspective. So I also did a little thematic analysis, and I'm going to share with you 3 pieces because I know we have limited time. So I'll share with you 3 themes that are definitely emerging. One of them is just the fact that this accelerates the speed at which they can connect with one another. They might use it to promote a passion, to learn information. Within BCSM, we're seeing that people go to conferences and then they report out within the community. This is a community that's not just patients. It is patients, providers, advocates, researchers. So it's unique in that, and I'll get to that. But that this allows them to meet other people in a much more like just-in-time fashion if you think back to Alice's story, how, about how people plug in quickly and get answers quickly than they might otherwise. And in a MedXy move, I actually have quotes from people from the interviews themselves, but I seated some people in the audience as opposed to putting it up on the screen because their voices are not my voice. And so my hope is that you sort of hear this that these are all different people saying these things. So who has number 2? You're number 2. So welcome, BCSM number 2.
I said, my oncologist wants me to take Zometa. Anybody's done it? What do you think of it? Did it work? Was it horrible? And tagged it BCSM. Then someone responded and we had a chat about it. First, she gave me some good things to think about. Then the next day she found an article about it that she tweeted to me. It was amazing. The response was so quick, I tweeted it, and maybe like 10 minutes later, somebody responded, which is pretty remarkable.
So you can see some of the speed. Who is number 3? Are you a projector? Do you need this?
Where I learned about something I could do.
Thank you. So you can see people use it not just as a means of getting clinical information, but really as a means of also finding their advocate voice or finding a voice that's beyond. In my head, I always have this inverse relationship between the need to be validated and the sense of empowerment, and that the less empowered you feel, the more that you need more validation for all the good things that you are already doing, because everyone in the room is an expert on something. And so as this community is sort of allowing people to get that validation so that they can feel more empowered, and that leads to statements, I think, like patient number 3. The next theme that I just want to share is that the participant mix in this community, I think, is unique. It's something that has been talked about at MedX, but we haven't seen it as much, and also something that's contradicted by Dr. Lee's research in terms of where people want to sit. But within this community, the participant mix really makes a difference. So there are, as I said, physicians, other healthcare providers, mental health providers. There are basic science researchers. It's driven by patients. It was founded by patients, and that's still the majority of the mix. There are advocates, so there are caregivers, and all of these people coming together in this space makes a big difference in what conversations take place. So this is one of the most talked about aspects within the interviews, and it's something that they've dedicated a few chats to as well. So just to illustrate it, and actually one of the points I wrote down I wanted to make is that even within the roles, so maybe you come in as a patient, but you have diversity even within your role. So you see patients that are survivors for quite some time. So they're coming in, or maybe they're tweeting from a hospital bed. And you really see that even within specific roles, there's diversity within that as well. And I think that that's really significant as well, because that lends itself to some of the give and take that happens within the community. So, all right, who's my number 4?
I'm a patient. This one doctor was saying that was patient for him. I replied to that, but I wasn't the only one, because he came back and he said, I need to rethink this. Like my own reservations about what might be. Why do you think it's beneficial that doctors now really?
Isn't that something that you've heard like all week? But this happens to be one space where it's actually happening. Who's my number 5? Thank you. So, and I think that quote also brings in the additional point of that not everyone has to be online, but there are people online bringing it into their offline world as well, and then that they can bring their offline world into the online conversation. So not everyone has to be on Twitter, but the fact that there are these bridges being built, and that advocate really can use the participant mix as a mechanism or means of saying this this information is valid is really significant. So the third point that has come up a lot and that I'll share with you today is that the community itself is really more of a portal than a port. You can also, I was trying to think of good metaphors. You could say it's a launching pad, not a landing strip. But the point is that, based on the interviews that I've had, this community really acts as a means of people knowing more, sharing more, learning more, but they don't keep it within the walls of BCSM. People get pulled in, like I told you a slice of Alice's story, how you get pulled in, and then you might start to participate. But people connect with each other all the time outside of BCSM, which I'm not capturing, and I don't know if I need to capture, but they're really using this as a means to create ongoing and real relationships. So with that, I'm going to give it to number 8? Yeah. Do you need a mic? Okay. That's really powerful. I mean, Twitter is real life, but that she still separates it that. I always cry a little on the inside when I hear that story, because I think I never lose the gravity of the people that I'm talking to and the gratitude I have that they'll talk to me in the midst of being metastatic. So beyond that. So thank you. I don't think I could have read that. You would have also done it in a Southern accent if you had been her. Am I into questions or I'm into... I'm out of time. Okay. Sure. Yeah, that's fine. Thank you, my audience, people.